I am an occupational therapist by background. I actually worked, I say worked because theoretically I'm retired. But I worked for Encompass and the previous company that it was for probably approximately 30 years. And so if that is not a testament for a place, I don't know what is, because it is a wonderful, wonderful place to be, not only to work, but obviously for the patients as well. And everything they said in the video is absolutely true. So I was very fortunate when I retired a year or so ago. Amy and the marketing team decided, well, basically they said, you know, if you want to stay on, you can stay on and do whatever you want. And I'm like, okay, let me do what I want to do then. So as part of my job before, I used to go out and do talks. Some of you may recognize me. I've been coming out here for quite a while. And so I said, well, yeah, sure. So Amy gets hold of me quite a lot, and we still go out and do these talks. So this is definitely one of my favorite parts of the job that I used to have. I don't have to get involved with all the management of the stuff that I was doing before. So this is like my ideal job. And then I get to hang out at home sometimes as well. So that's really nice. So I am going to talk about stroke prevention and signs and symptoms and all of those things. It's really important. This is Stroke Awareness Month. And I think even if you've heard some of this information before, it's really important to review it. There are a lot of things that we can do to help to prevent strokes. And if you are unfortunate enough to have a stroke, it is so important to recognize the symptoms early. Don't disregard them, because there are a lot of things that we can actually do to improve the outcomes if you do actually suffer a stroke. So right before I came in, I thought, well, I've had this talk for a while. Let me just see if there's any change in the statistics, because I kind of like to make sure that I'm kind of up on my statistics. I do talk statistics to start with because I think it's a sobering thing to talk about. I think you'll be quite shocked at some of the numbers, and I think it kind of gets your attention a little bit. The statistics have not changed. I literally Googled them before, literally sitting out in the car, to make sure that these are the most up-to-date numbers that we have. So every year, greater than 795,000 people in the USA have a stroke. Now, bear in mind, these are older statistics. I want to say they're probably maybe 2020 or even sooner than that. So imagine with the population that it is, especially with all the baby boomers coming up, how much that number probably has increased. I wish they would update the numbers. 610,000 of those are first or new strokes. And I say that because the incidence of having a repeat stroke once you've had one goes up substantially. More than 185,000, that's nearly 1 in 4 people have had a previous stroke. So again, you know, knowing the signs and symptoms, understanding the signs and symptoms is really important. Stroke kills 140,000 people. That's 1 in 20 deaths. It occurs every 4 seconds, and every 4 minutes, a person dies from a stroke. In 2016, this is how old these statistics are. So we've gone 10 years. Imagine how much those statistics have gone up now. 1 in 6 deaths from cardiovascular disease was a result of a stroke. So it's huge. This disease takes the lives of many, many, many people, okay? The risk of having a stroke varies by ethnicity and race. African Americans are almost twice as likely to have a stroke as Caucasians. The risk of stroke increases obviously with age. But I will tell you, stroke occurs at any age. We have had, and certainly when I was working at the facility, which I haven't really worked in the facility for a year or so, but I was seeing younger and younger and younger people coming in with strokes. And I'm talking anything from 25 to 40. That was, it was not unusual to have 3 people in that were 40 years of age that had suffered a stroke, which, you know, everyone thinks, oh, well, strokes for older people. It isn't anymore. You know, there are a lot of people have a stroke younger than 65. in 2009, we really are going back some now, aren't we? 34% of people hospitalized for a stroke were under the age of 65. So it's not just an old person's disease, unfortunately, anymore. All right. So what is a stroke? Does anybody know what a stroke is? Crickets. Right. It's something that happens in the brain. Yes. Anybody else got anything? Right. There are actually two different kinds of strokes. So a stroke is a sudden loss of blood flow to an area of the brain. Strokes can be referred to as a cerebrovascular accident, a TIA, which is a transient ischemic attack, or a brain attack. It's kind of like a heart attack, but in the brain. So it is a sudden loss of blood flow. There are two types of stroke, and someone just said that it's a clot in the brain, right? The first type of stroke is an ischemic stroke, which is the most common type. Approximately 80% of strokes are the ischemic type of stroke. And that is where fatty deposits build up in the vessels and then kind of release, and it can cause a blood clot or a thrombus. The clot can also travel from other places. So if you've got fatty deposits in some of your other vessels, it can break free, travel up through the vessels, and lodge in your brain. So this is called an embolism. And in this type of stroke, if you don't remember anything else, remember this. In this kind of stroke, it is a clot. They can give a medication called TPA. It's a clot buster medication. They will not give you that medication unless you can tell them exactly when the first signs and symptoms of your stroke occur. They will not give it to you because it has to be administered within 3 hours of onset of symptoms. So if you're feeling funny, fuzzy on one side, you're feeling a little numb on one side, I don't mind or think if it's something else, you get to the hospital as quickly as possible because it could be the first signs and symptoms of a stroke. And honestly, it is worth it because I have seen people who have had that medication whose outcomes are significantly improved by the fact that they got that medication, right? So basically what it does, it breaks up that clot as quickly as possible to allow more blood flow to happen. Okay. Now, the second kind of stroke is a hemorrhagic stroke. So hemorrhagic, what is a hemorrhage? What is a hemorrhage? A bleed. Okay. So if you have a hemorrhagic stroke, are they going to give you a blood clot busting medication? No, because what's that going to do? Make the bleed worse. So it's important to get to the hospital as quickly as possible so they can identify what kind of stroke you had in order to be able to know whether they can give that medication. Now, as I say, the most prevalent kind of stroke is actually the ischemic stroke. So most people that are going to the hospital are having that kind of stroke. So if you think of it as like a plumbing system, right? Think of it as a plumbing system. If something gets stuck in a pipe, what happens? Yeah, it backs up. Water doesn't get through. What happens then? It bursts, right? And then it goes all over the place. And so where that occurs, the leaks cause the damage around that area. Strokes are actually one of the most fascinating diseases. Therapists and nurses are a bit weird. They get excited about stuff, which is unfortunate when it's happening to somebody else. Probably wouldn't be quite so exciting if it was us. But strokes are one of the most fascinating things to actually treat because they're all different. You never know really what you're going to get, right? So it's just, we'll go on to that in just a minute because I'm going to describe the signs and symptoms of what happen when you do have a stroke and the results of where the stroke occurs, what's going to be caused. But it's extremely important, I'm going to reiterate this multiple times, to make sure that you respond quickly. And if you think you're having a stroke or you observe signs in others, act fast. All right. There's a mnemonic that says be fast. I don't know if that is a mnemonic, but think of those letters. Be fast. Okay. So who can tell me what you think B stands for? Whoops. I just demonstrated it right there. Balance, yes. So the first thing is sudden onset of loss of balance, or you get numbness down one side and you kind of don't feel it anymore. And so your balance is kind of off. All right. So sudden loss of balance or difficulty maintaining your balance, right? That's B. E. Eyes. Who said that? Perfect. Yes, eyes. So vision changes or vision loss, and we'll talk a little bit about the kind of vision changes that we're talking about. But vision changes, again, sudden loss of peripheral vision. I'm not talking about things like cataracts and glaucoma and those kind of things. This is a sudden onset of a change, okay, where you are suddenly not able to see something on the right-hand side or the left-hand side. F. What is F? Yes. What happens to the face? Facial droop. Yes. So you're out for lunch with your friend and suddenly she starts looking a little bit strange and the side of her face starts to kind of droop a little bit. It could be something else. Could be Meniere's disease. Who knows? But if you see that happening and when somebody smiles and they have an asymmetrical smile, by asymmetrical, I mean one side will go up and one side will go down. That means that it could be the onset of a stroke. So again, observe the face. A. What does A stand for? Arm. I'm not trying to give you any clues at all with this, but I thought I was quite subtle, doing this thing. So again, numbness in your arm, you have sudden weakness in your arm. You try and raise your arm and you can raise one up and the other one's kind of doing nothing or flopping around by the side of you. Again, that could be a sudden onset of a symptom of stroke, right? So heaviness, numbness, people think, they've been sitting in kind of like when you're sitting on your hand and it goes numb. It's not like that. It's a total numbness, heaviness in your arm. S. Thank you. Speech. No, we already did the smile. The smile's in the face bit. Speech. Okay. You're sitting having lunch with your friend again, and suddenly you're asking questions, and some of the answers that are coming out are totally not making any sense at all, or they're having difficulty in expressing themselves. We have, some and we'll talk about this in a little bit, but aphasia is one of the most frustrating symptoms of a stroke. I don't know if you've ever had a friend who's had a stroke and has had their speech involved. It is extremely frustrating. But, you could be asking them, how's the weather? And they could be saying, well, lettuce and tomato is, it's what we call actually word salad, basically where they literally are saying nonsensical things. Or like I said, they can't answer you. They can't find the words. They're having difficulty, or the words are slurred. They could be slurring of the words as well. And then what's the last one? And every single one of you should know this, because I've said it already a million times. T. Yes, time. Time is of the essence. Essence. Is that what? I don't know. Time is of the whatever it is. Am I having a stroke? Oh my gosh. If you observe or feel any signs, time is of the essence. I have it written down in front of me. Look at that. And I didn't read it. Call 911. Okay. Take note of the time that symptoms started. You may also have a sudden onset of a headache as well. All right. So quick review. B fast. B. Good. A. Wait. Oh, E. Sorry. Eyes. Darn it. F. Yes. A. S. I'm having to read it because I can't remember the letters. Isn't that terrible? And T. Good. Okay. I have that on my fridge, right? I have a magnet on my fridge that says all of those things. My husband is not medical. He's dead lucky because I know this stuff, but I'm not. So I have to have it plastered up there just in case to tell him. So in my stroke moment, I will be pointing to the fridge. if I can't tell him in what have you, because he needs very explicit directions, you know. All right. So why is it interesting for a therapist or a nurse or somebody to deal with somebody with a stroke? Why would that be? It's because the effects of a stroke may differ dependent on what area of the brain is affected. Now, our brain is fantastic. I don't know if you've ever thought about it, but it is one of the most brilliant things ever. It controls everything, right? It controls our movement, it controls our thoughts, it controls our questioning, it controls our problem solving, it controls our motor function, it controls absolutely everything that happens. My brain is completely in control of what I'm doing right now. I'm talking, I'm walking backwards and forwards. I am doing all sorts of things, reading, all sorts of things, moving my hands. And I'm not thinking about it, but my brain's doing all that in conjunction with a lot of other things. So depending on what sort of area the brain is affected, depends on what component of the body or part of the body is affected. So, okay. So if I have, this is actually, I'm not putting it down because I'm going to get it wrong if I don't have it in front of me. So the right side of the brain, and now, watch my hands, don't listen to my voice because sometimes I get confused with right and left. So where I'm pointing, my right side of the brain affects which side of the body? The left. There is a crossover right at the base here where it crosses over. So the right side of your brain controls the left side of your body. Conversely, the left side of your brain controls the right side of your body. Right. The motor cortex is right at the top. So depending on which side the stroke occurs, depends on which side of the body is affected. But it also affects things like your speech and your thinking and your judgment right here. You know, like those, 24-year-olds that think they've got a fully developed brain because they're frontal, but the frontal lobe is nowhere close to, especially boys, sorry. Frontal lobe does not develop until they're almost close to 30, actually. No, it's 27 or thereabouts. But that's the judgment side of things. So if you've had a brain stroke in the front of your head, what's going to happen? Everything goes out the window. Basically, you've got no judgment. You're going to do daft things. I mean, seriously. Anyway, so with a left CVA, there might be right-sided weakness in the arm and the leg. Speech and language issues may occur. Aphasia is a difficulty with speech, and it can be either receptive, so understanding speech coming in, or expressive, understanding or trying to speak going out, or in the worst case scenario, it's both. They have global aphasia is what it's called. And that is where both expressive and receptive speech is affected. Can you even begin to imagine how difficult it is to communicate your needs if you can't express it and you don't understand what somebody's saying to you? It's one of the most frustrating and most difficult things to treat in a stroke. It's very difficult. Dysarthria is difficulty with articulation. So speech, obviously, you have to articulate when you're talking. So again, there may be slurring, there may be a loss of or a weakness in the tongue so that they cannot form the words as well as they, did beforehand. Swallowing issues may also occur. And again, this is very challenging because the mechanics of the swallow can be affected. If you've got facial weakness and weakness in one side of your neck muscles, that kind of thing, imagine how difficult it is to coordinate a swallow. We don't even think about it when we take a bite of food and swallow. But if you've got numbness, food gets stuck in your side. You get to be like a little squirrel, and you keep food in because you don't feel that food is in there. Food goes down the wrong hole. So there's a lot of coughing and choking. So a lot of times, if there are swallowing issues involved, you have to start looking at modified diets. Some people can manage regular food. Some people need to take very, very small bites. Some people may have to have their food pureed. And some people, unfortunately, can't take food in by mouth at all. So they have to have the tube. Again, with liquids. Thin liquids, you probably don't realize it, go down very fast. But when you've got an effective swallow mechanism, liquids go down exactly where they're supposed to go down because your epiglottis closes over where it's supposed to close over and everything goes down the right way. But if you've got delays or weakness in any of those mechanics in your swallow, you're going to choke, right? The stuff's going to go right down the wrong way and end up in your lungs. So again, it's really important that you know about that. It can also cause memory loss, slowness, and cautiousness, which actually with a stroke is probably more beneficial than the other side of things. So those are the things that if you have a left CVA, right side of the body, left CVA. With a right CVA, there may be left-sided weakness, visual problems, inattention or neglect to the affected side, motor control issues, impulsivity, and decreased problem solving. Now, with both, there could be sensory loss as well. So we have so many different systems in our body. Like I'm standing here, I can feel the floor through my feet. I don't think about it. Oh gosh, I can feel the floor. That's why I can walk. We have a lot of proprioceptive kind of pathways going through brain to the different joints, all that kind of stuff. When you've had a stroke, some of those things don't happen. And if you've got sensory loss, you have left-sided weakness. There's nothing sensory-wise that you can feel. What happens when you stand up? Oh, especially if you've got impulse problems. Oh, I'm going to go and answer the door. What do you think is going to happen? They're going to end up in a puddle on the floor. They are, because they don't know that they haven't got that left side. I've had people who have had such bad neglect, because not only that, the visual side of things. So you could lose half your vision on both sides of each eye, on one side of each eye. So guess what? Your world has gone away on this side. You've got no sensory input. You've got no visual input. You can't feel it. You can't see it. I'm walking through a door. Am I likely to hit the door? I am. So we've had people in their wheelchairs just ramming into doors because they just don't see it. Or this is very cool. This is why OTs are very warped. But anyway, if you actually show them a picture, you draw a circle and you ask them to put all the numbers of the clock. It's a really easy thing to do, right? All the numbers of the clock round the clock. Guess what they do? They put every one of the numbers down one side of the clock. So think about this from a functional perspective. You put a plate of food in front of them, they're only going to see half the plate. If you put their drink on the left side, they probably know it's there. They can't see it. So they're never going to reach for it and take it. So again, they know if you're talking to them, they know you're over there, but they can't see. They'll say, I can see you. I can see you. They're looking over here and you're over here and they're talking to you over there. No idea. That's how profound it can be when you have that visual and sensory loss. It's incredible. I had one lady who I have never seen neglect as profound as hers. She literally sat in her chair like this. And I could be standing over here, and no matter what I told her, come on, turn your head. Can you find me? Whoops, sorry. Can you find me? Can you find me? Oh, yeah, you're there. Yeah, no, I'm not there. I mean, she literally had no idea where she could hear me. She could talk to me, but she couldn't find me. So a lot of times when we're treating patients with stroke, if they have got that sensory and visual loss, we will encourage family members to sit on the wrong side of them, to sit on that side, to try and encourage them to turn and look and see where it is. Reading a line. Some people can still read, but they will read half a line. They won't read the whole line. So other general effects, those are the most profound effects from having a stroke, or the effects from the brain. Other, wait, I've lost my thing. Obviously, other effects can be incontinence, and that's a very devastating thing for anyone as well. Okay. So what are the risk factors for strokes? You guys, I'm sure, hear this all the time, what you're not supposed to do and what we're supposed to do to keep ourselves healthy and all that kind of good stuff, right? So age greater than 55 years, well, if anyone can tell me how to stop that from happening, that would be lovely. But nobody's come up with a cure for getting old, unfortunately. Family history of heart or stroke, heart disease or stroke is also a risk factor. These are the factors we really can't change, by the way. Race, risk is greater in African Americans and Native Americans, believe it or not. And here we go again, ladies. If you're female, you're more likely to have a stroke. It seems we get all the stuff, basically. It doesn't matter. Yep, we get it. There are factors that can be controlled to a degree, though. Things like physical inactivity, even a small amount of activity every day, not sitting around in a chair watching TV all day. High cholesterol, blood pressure, heart disease, things like AFib or coronary artery disease, diabetes, cardiomyopathy, and atherosclerosis, which is the hardening of the arteries. We can control that to a certain degree. We can certainly be a little bit more active, maybe, and we can certainly have medications which continue and can control some of the things that are happening to us, right? Risk factors that can contribute and can be controlled are maintaining a healthy weight. Obesity has been known to increase your risk factor for stroke. So eating a healthy diet, low in saturated fats, trans fats, cholesterol, and high in fiber. One of the best diets that you can have is the Mediterranean diet. It's healthy fats, healthy oils, fresh vegetables, all of those kind of things. I'm going to research it, but I'm pretty sure that in the Mediterranean countries, I can guarantee you that stroke incidence is lower than it is over here and in England. Just in case you hadn't noticed, that's where I'm from. Poor response to stress. We have so much, and we just went through, I don't know how much longer I can say we just went through, because it's been about, 5 years now. But things like when we went through COVID, how much stress was everybody under with that? Certainly the uncertainty at the beginning of it, and then, the difficulties that occurred as a result of it. We all have stresses in our lives, and depending on how you handle that stress can certainly impact your risk factor. Alcohol consumption, it's said that limited, now don't go crazy when I tell you this. It's said that limited alcohol intake can help to reduce the risk of strokes. So what is limited? Okay. Occasional glass of wine. That does not mean to say you can drink a bottle of wine every day. Occasional glass of wine is okay. More than 1 to 2 glasses significantly increases your risk of stroke. Do you know, it was funny when I was doing, I don't know what I was doing it for, but probably one of the things at the doctor's office, where you have to fill in that form. And it said, how many glasses of wine do you drink a week? And I'm like, ooh, am I going to be honest with this, or am I not going to be honest with this? It doesn't matter. If you have more than 2, they think that you have an alcohol problem. It doesn't matter if you have 2 glasses of wine a week. If you have 3, it's bad. Bad. Seriously, that's ridiculous, totally ridiculous. Smoking. Fortunately, smoking has gone down, but smoking increases the risk of stroke. So if you do smoke, think about a smoking cessation program. And then inactivity. This is something we can control. Now, I am not talking about you going out and training for a marathon or anything like that. It's not about that. It's just being a little bit more physically active. And there are a lot of things that you can do. You can walk to the end of the driveway and back to pick up the newspaper, which nobody ever has them delivered anymore. But I keep saying, to get the mail. I'm going to change it to go and get your mail from the mailbox, right? Or go for a gentle walk around the block. Even my mom is 99 years old, and if she can't go outside, will walk up and down her lounge, which is probably about as long as this. So she'll trundle with her little walker up and down, the lounge to get her exercise in. So Good forms of exercise do include things like walking, swimming, biking. Be careful. It's crazy out there. Don't go on a bike on the main roads, and always wear a helmet. I mean, seriously, it is nuts. It's bad enough getting in a car and going on the roads out there, never mind going on a bike. It is not happening, I'm telling you. I walk in my neighborhood, and I'm not kidding. Some people are so rude. We have a speed limit, and it's the biggest thing that's talked about on our Mill Creek Facebook thing is, why are people driving so fast? You know, I've been out in the morning and literally had to step onto somebody's garden because they will not go around me. I've almost been taken out a couple of times. And I'm like, what is wrong with you people? We had our first deer sighting today in our garden. For several years, we had a doe that laid her baby in our garden every single year for about 4 years. Haven't seen her yet this morning, but today was the first day we saw her. She's definitely had the baby because she's not got a big belly, but she's coming around. And so we have kids in the neighborhood, we have dogs in the neighborhood, we have deer in the neighborhood. People need to slow down. It's just so bad. So anyway, how did I get onto that? Oh yeah, don't get on a bike without a helmet and make sure it's a protected area. Group exercise is fun. I know you guys here. I see it. This is wonderful. All the exercise equipment you have. Look at this. You have bicycles over there. Brilliant. And it's much more fun when you're doing it with somebody else, right? It's much more, and you hold each other accountable for doing it. It's very easy to not do it when you haven't got somebody saying, okay, let's go to Parkinson's place and let's go and do our exercise class. Why weren't you there? Right? Why are you not here? What's wrong with you? Why did you not come? Right? It's much easier if somebody's checking on you. So all of those things can help to reduce the risk factors for stroke. So it's just basic stuff. You know what we're supposed to do. The risk factors for reducing risk of stroke often reduces risk of other conditions as well. You know, it's just common sense, really, right? How can we prevent an additional stroke? Like I said, 1 in 4 people are potentially going to have another stroke within 5 years of the first one. And they usually do get to be a little bit more profound. So you may have got away with a slight one the first time round, but it will get significantly worse. So monitoring blood pressure and controlling hypertension, take your medications, check your blood pressure, try and decrease your stress level. So, don't go and get your blood pressure taken at the doctor's because mine goes, yep, every time. I don't know why, because doctors don't bother me. I've worked with them the whole of my life. It's not like they bother me. It's just, but isn't it the case? They put that thing on your arm and they ask you how you're doing. And you're like, I'm great, fine. Oh yeah, your blood pressure's 130 over 100. I'm like, no, it's not. It's not like that at all. Stop smoking. Drink in moderation. Remember, 1 to 2 glasses a week. If you're not, it's bad. More than 2 glasses. See, I save all mine for the weekend. I don't drink during the week. I save them for the weekend. Like I'm retired, like it actually makes a difference, but I do not drink during the week unless my sister's here. And then it's just all bets are off at that point, which she was for almost a month. And it was bad. I'm still recovering. I told her the week after she left, I had to dry out. It was so bad. But anyway, I save mine. So I have my 2 little glasses of wine on a Friday night, because that's my little treat for the weekend. Monitor and control diabetes. If you do have a predisposition for diabetes or you are diagnosed with diabetes, it's so important to monitor your blood sugars, not only for reducing your risk for stroke, but also it can cause an awful lot of other bad things, sensation loss, visual issues, poor healing, that kind of thing. So really do, if you are diabetic, monitor your blood sugars and try and stay within your limits. Exercise regularly and eat a healthy diet. That's easy, right? I'm a cookier. My husband's idea of a healthy diet is let's not eat anything during the day and then let's have Margaret's cookies for dinner. Every night he eats cookies. So I have to restrict him. He's really happy at the moment because I got quite a lot left over from an event I did. So he's very happy right now. Minimize exposure to stress. That is difficult, but there are a lot of things you can do. Yoga is wonderful. Tai Chi, just even sitting and relaxing. I was telling Amy, I did an event this weekend, and it was actually at the Jewish Federation. It was at the new building on Macintosh. And I had about 10 minutes aura. Beautiful, absolutely beautiful. And I had about 10 minutes for lunch, and I sat in the memorial area by the lake. Oh, it was like this whole peacefulness. So even if you can't go to the aura place, which is beautiful, go sit outside for 5 minutes and just take a breath. Deep breathing, relaxation, all of those things. If you know you're getting, hyped up about something, take a breath, step away, and relax for a little bit. Always remember that time lost is brain lost. Okay. Again, remember that mnemonic, that be fast. T is probably one of the most important things. If you see any signs and symptoms at all of anything happening, then act. I would rather you go to the hospital and they tell you, nope, you're absolutely fine. Yay! That's great. Then you say, well, I feel kind of off. Yeah, I got a little bit of numbness. It feels weird in my arm. I'll just see how it pans out for the next hour or so. Yeah, no, definitely not. I've had people who have felt a little off when they went to bed at night and had a full-blown stroke during the night. And at that point, there's nothing they can do about it. It's too late. When did your symptoms start? Well, around 8 o'clock last night, and it's now 2 o'clock the next day. It's not going to be good. So remember, time lost is brain lost. So doom and gloom. Yeah, strokes are horrible. They, except when you're an OT, and then they're kind of interesting. But they're devastating events that occur in many people's lives and do impact not just the person who's had the stroke, but the family members. Like any disease, like the Parkinson's, it's the same. Your whole family are impacted by this. You lose your independence. You are reliant on somebody else to do things. You have frustrations because you cannot talk to somebody. You can't move a limb. You can't go to the bathroom on your own. I mean, it's pretty difficult. So although it can be very devastating, it's important to remember that as well as acting quickly to minimize the effect of a stroke, the brain is incredible and it has the capacity to mend, right? Especially during the initial phase of the stroke. So research shows that function can return for several months to potentially years after the stroke. And this is fairly new stuff that came out probably about 15 years ago. They realized there was this thing called neuroplasticity. And this is where the brain has the ability to kind of grow new pathways around the areas that has been damaged and form new pathways that can re-assist parts of the brain to work again. So that's why you can often find somebody has no movement at some point, and then suddenly they'll start being able to move their shoulder. Or it's funny, sometimes we even get distal movement. We'll see a finger moving or that kind of thing. So the brain has that phenomenal capacity to be able to not necessarily mend itself totally, but reform these phenomenal pathways. I told you the brain is just a brilliant thing. Look after it. Look after it. It's very important. Again, neuroplasticity is the ability of the brain to establish new pathways around the damaged area of the brain to help to restore function. Rehab can be a very, very long process, but learning new strategies to compensate for lost function and retraining the brain to help to establish new pathways can help to increase independence in self-care and mobility. So even if you do not get that movement back, as an OT, our whole role is to teach you compensatory. That was the English way of saying it, wasn't it? Was that the English way of saying it or the American? I can't say it. But anyway, teach you compensation, can't even say it now, ways to do things. So, when you get dressed, you put your arms in, you stick it over your head. Well, suddenly 2 arms aren't working. So what do? Everything has to be done by one. So we teach you how to do it with 1 arm. It's a feasible thing to do. We can do it. There are a lot of one-handed adaptive equipment, pieces of adaptive equipment. We teach people to compensate for visual loss, to, learn how to scan their environment differently. PTs and OTs both teach you how to walk properly. You may need an AFO or something to help you, or a device to help you to walk, but the brain has that capacity to be able to do that. So it's either a compensation that we teach you or a retraining, where we are retraining the muscles to work again. It is a long process. It's important that when you do have rehab, it's intensive, especially initially, okay? The more intensive you get in those first months is the better. So that's why somewhere like we are, I mean, I'm not, singing our praises, but we are a true rehab facility. You get 3 hours minimum of therapy a day, 3 hours of therapy. If I was doing therapy for 3 hours, I'd probably be in a lot better shape than I am now. Can you imagine, like going to the gym for 3 hours and then bombarding you with talking, and OT's telling you, well, get yourself up and go and get in the shower, that kind of thing. It's a completely interdisciplinary thing, and it's not the same as if you go to somewhere like a nursing home where they have a rehab facility, but they're not giving you that intensive stuff. We see big improvements in the first 10 days. It's brutal. People don't like us. Usually they kind of like us after about the second or third day. But the first few days, nah, they don't like us, especially the OTs, because we get to go in first thing in the morning and tell them, okay, we're getting up today. Oh, no, I'm too sick. I can't do it. No. Oh, yeah, you are. We're going to have a shower. They usually like us after they've had the shower, because at the hospital, they don't get a shower. So we can usually tempt quite a lot of them with the shower, so that they're like, oh, it's so good. Yeah. Well, it is good, but you have to do it yourself. We're not doing it for you. We are not nurses. You do it yourself. So that combination of OT, PT, and speech, wherever you go, it needs to be as intensive as possible. And even if you go from us to another facility or transition to outpatient, that intensity makes the difference. Okay. There's often also a huge psychological component, as you can only imagine. Your life has completely changed. So it's really important also to get that psychological assistance to help both you and the family members to adapt to these changes. So anyway, I think I'm pretty much done with talking. I know we've got questions. Yes. Yes. Right. And it showed that he'd had a brain bleed of some description. Right. Yeah. Yeah. So there weren't any overt symptoms necessarily, or there were symptoms that didn't leave you with any, but it was because you had some kind of another incident that they scanned your brain. Yeah. Okay. Interesting. Yeah. And it obviously was fairly small. The bleed was probably fairly small. Yeah. Oh, okay. Right. Right. So, I mean, I don't know that there's that much of the brain doesn't do something, but it's like, why have we got pieces of the brain that aren't doing something useful? They could have made the brain smaller. Yeah, yeah. It's like a silent heart attack. It's the same thing. Oh, yeah, you've had an MI. Well, I didn't have any chest pain. I didn't have anyone sitting on my chest. I don't know I was having a heart. But again, it's the same thing. I guess it's a very mild form of, yeah. Interesting. Any other questions? Oh, yeah. Sorry, I'm coming over there because it's hard to hear. Get them to the doctors, get them to the, not even the doctors, get them to the emergency room immediately. If you think anyone, even if you're not sure, but they show any signs of something that's, occurring, like a sudden loss of balance, or they complain about not being able to see out of one side of the eye, or there's facial changes, call 911. In fact, I would call 911. I wouldn't take them in the car. Call 911. And then they can start acting straight away. So no question, don't hesitate, because even if you go and they're not having one, that's great, but at least you know for sure. So. Yeah, I mean, I don't know of anything that you can actually do. It's not, you can't do CPR on the brain. So just keep them calm, sit them down and wait. Yeah, I don't know that there's a lot else you can do. That's when it's hard, because, unless they wake you up and say, hey, I'm not feeling good, sometimes people don't. And that's what I've said. People have gone to bed. They've felt a little off before they've gone to bed, but it could be, oh, well, I think I ate something, or I'm just feeling, did I sleep on my arm wrong? Or, that kind of thing. So again, it's difficult when it happens during the night. But definitely the first thing you do, time, fast. Get them to the emergency room as fast as you possibly can. Any other questions? All right. Well, great. Thank you.